Hi, everyone. My name is Grace. Welcome to my presentation. Today, I'm going to be reviewing a paper titled The Impact of Exercise Interventions on Physical Fitness in Breast Cancer Patients and Survivors. So, this study is a systematic review. It was initially published in 2022 in the Journal of Breast Cancer, which does have an impact factor of 2.7. So, it should be a very well respected oncology journal. The authors are affiliated with major institutions, some of which include the University of Palermo, the Technical University of Munich, and Umea University. So let's go ahead and talk about the background and findings of the article. Breast cancer is one of the most frequently diagnosed cancers worldwide, if not the most frequently diagnosed. There are 2.3 million new cases that were reported in 2020 alone. While treatment has increased survival rates, side effects from surgery, chemotherapy, and radiation, which are all common, they do unfortunately include symptoms. Symptoms include fatigue, loss of strength, um, related quality of life, etc. Anything that really you can think that cancer would do to a person, it really does do it to a person. So this study is here to kind of look at how exercise is going to impact these side effects. Exercise is seen as a complementary approach to reduce side effects. Um, so, talking about the purpose of this review was to systematically examine how exercise interventions affect cardiorespiratory fitness, strength, fatigue, and quality of life in both breast cancer patients who are currently undergoing therapy and breast cancer patients who have survived and completed treatment. The article was reviewed following the PRISMA guidelines. The authors searched in PubMed anything from, I believe it was 2000 to 2020, and they only included randomized control trials, including women with breast cancer. The women who had the breast cancer either needed to be currently undergoing therapy or have undergone therapy within the past 5 years. The eligible interventions initially were aerobic training, resistance training, combined programs, and yoga and Pilates. But the main outcomes did end up being cardiorespiratory fitness, strength, fatigue, and quality of life. So, from almost 17,000 initial studies, only 22 met the inclusion criteria. But the good thing was, in these 22 studies, there was more than 2,000 participants. So, a really good number for this study. So, in total, 734 participants or patients were undergoing therapy, and about 1,279 were survivors. The interventions themselves lasted about 19 weeks on average, with 3 exercise sessions a week, usually at a moderate intensity. The patients in therapy, um, this is a little bit about them, but the exercise prevented the decline seen in control groups. So the resistance training showed the biggest benefit for them, with a 22% increase in strength and a 12% improvement in quality of life. The aerobic training also did help, but the combined interventions were less consistent than the cardiorespiratory fitness. The survivors' benefits were even greater. Aerobic training improved cardiorespiratory fitness by about 9%. Resistance training increased strength by about 34% and quality of life by 10%. So we can see the combined interventions were the most powerful. Strength improved by 43%, fatigue decreased by about 60%, and quality of life improved by about 13%. I did include some graphs just to show visual representation So this is just a graph of the strength improvements between aerobic resistance training and then the trainings combined. So you can see that there was a pretty consistently like higher numbers in the survivors strength here, as well as consistently higher numbers in the survivors as well in the quality of life improvements. um, the programs are pretty feasible, as you can tell. Most of them did increase in terms of improvement. The adherence to these programs was about 80%, so um, they were very beneficial to the patients, and the patients did notice that. To summarize some of the main findings from this article, it's safe to say that exercise is safe and effective for breast cancer patients and survivors. During therapy, it did show to prevent declines in fitness and reduces fatigue. For the survivors, it significantly improved cardiorespiratory fitness, strength, fatigue, and quality of life. So the resistance and combined interventions did show to be the strongest in terms of overall effects. So, in short, I do think that exercise should be considered part of supportive care. This article did support that idea. There were strengths, there were weaknesses to this trial. Some of the strengths included that this analysis included only randomized control trials. Um, it applied, um, what word am I looking for? Like a big bias assessment, and pulled like a large sample of about 2,000 participants or over. So lots of people, which makes the study more accurate. Um, there are also some weaknesses to the study. Um, some of the individual studies did have small sample sizes and short exercise durations. Um, the exercise protocols did vary, making the comparisons between articles a little bit harder than usual. Um, the fatigue and quality of life were often self reported from the patients. It does increase the risk of bias. And there also were um, really just few studies that overall tested the combined interventions. The combined interventions themselves did seem more successful for the patients. So it would be interesting to see further studies on the combined interventions, which takes me into future research. Um, More research is needed to evaluate these combined interventions. Like I was just saying, it's important to track the long-term benefits and to understand, the mechanisms behind these improvements, um, maybe psychological, physiological mechanisms in these patients, to see, what helped them, um, other than just their physical health. Um, It would also be, I think, important to look at standardized exercise prescriptions tailored to breast cancer patients. So taking these individual patients and standardizing, the cardio that we prescribe to them, the um, the stretching exercises, um, the aerobic exercises that we prescribe to these patients. It's important that they're tailored to their needs. So that would be cool to see. I do agree with the author in terms of exercise being an effective strategy to support patients. It's non pharmacological, it's easy, it's free. Everyone has access to exercise. And so this kind of leads me to my takeaway is that I do think that exercise should be prescribed in breast cancer clinical programs. It's important to tailor the exercise to the patient's needs, of course, but as an overall general idea of just implementing exercise as a treatment um, for our patients, I do think that that would be received and also executed in a really well way, and our patients would see huge benefits from that.